Hey y'all, this is Marley K. Hope y'all are well. Got something I want to share with you. I'm going to have to read directly from this article, and I'm not going to be able to say anything, although it's going to kill me not to. But every time I try to talk about this particular subject, I get a strike or they pull the video. So if you'd like to see my 2 cents on this, you will have to go to Rumble because they're just not letting us have these conversations unless you're in the medical community. Um, and even some of those individuals are getting their channels pulled and receiving strikes or being reprimanded by these platforms, the social media platforms, because the powers are clamping down on what we can and cannot say about this particular topic as they get ready to ramp up or accelerate their agenda for the next phase of the transition to the global order with the pandemic treaty and the UN Sustainable Goal Development Goals. It's a lot of stuff happening. All this stuff is not happening accidentally, and I feel like there are too many things going on for this to just be a coincidence. What I will say is the fact that this gene therapy or this therapeutic has gotten a Nobel Peace Prize is supposed to be some sort of validation or a mechanism for us to trust this technology. And I'm afraid a lot of people are going to find out when it's too late that they've been hoodwinked. So that's all I'm going to say. So let me get into it. This came from MIT Technology Review. I've brought you several stories from there before in the past. And so this story is from the biotech and health area. And it says the mRNA in vaccines just won a Nobel Peace Prize. I'm sorry, a Nobel Prize, not Nobel Peace Prize, Nobel Prize. Now they're ready for the next act. Scientists hope to leverage mRNA for a bevy of vaccines and therapeutics. This article came out on October the 6th. The other article that I read to you earlier about the viruses that were coming up from Siberia being dug up that were 50,000 years old, 48,000 years old, whatever, came out on the same day. Just say that. I ain't making it up and I'm not pulling out my butt. This is going on. So follow the dots, people. All right. So these are these, I guess, the scientists that are responsible for this stuff. All right. So it says this week, the Nobel Committee of Physiology or Medicine honored two scientists whose research into messenger RNA or mRNA technology paved the way for much lauded lollipops. Caitlin Carrico and Drew Weissman figured out how to tweak mRNA to prevent it from setting off an inflammatory reaction. Their discovery, first published in 2005, was key to developing the mRNA vaccines from Moderna, Pfizer, Biotech, part of a vaccination strategy that saved millions of lives. The Nobel shouldn't have come as a surprise to them. The pair has won other prestigious prizes, and many have predicted a Nobel was imminent. We flagged mRNA vaccines as one of the top 10 breakthrough technologies in 2021, but they still couldn't believe the news. Katie texted me this cryptic message at 4 in the morning. Did Thomas call? Weissman said at a press conference on Monday morning. I texted her back and said, no. Who's Thomas? She says, Nobel Prize. They suspected a prank and said they didn't fully embrace the win until the public announcement. Most vaccines train the immune system by supplying the pathogen against which they're meant to protect, either the entire pathogen or some crucial component. The mRNA vaccines work a bit differently. They provide genetic code that cells within the body can translate into proteins. In the case of COVID-19, the vaccines contain mRNA that codes for the spike protein found jutting from the outer surface of the virus. The body then produces copies of that protein and the immune system learns to recognize it. The idea of using mRNA in vaccines has been around for decades, but scientists hit a major stumbling block early on. Antonio Regalado recounted some of this history in his 2021 MIT Technology Review feature on mRNA. When researchers injected mRNA into mice, the animals got sick. Their furs get ruffled. They lose weight, stop running around, Weissman told Regaldo. Larger doses proved fatal. We quickly realized that messenger RNA was not usable, he said. When foreign mRNA are injected into the body, the immune system spots a threat and creates inflammation. Carrico and Weissman found that by tweaking the genetic code slightly, they could nearly eliminate this problem. Nearly eliminate the problem. When the pandemic began in 2020, scientists had already been using their method to develop mRNA vaccines for other infectious diseases, so it was relatively simple to pivot to COVID-19. What makes mRNA a game changer? The vaccines are so easy to produce. When manufacturers wanted to update their COVID vaccines this fall, they simply had to swap in a new code. By swapping in different codes, they should be able to target different pathogens. Moderna has already filed for regulatory approval of an mRNA vaccine for respiratory syncytial virus, I'm sorry, I skipped the whole word. Let me read this sentence again. So it says Moderna has already filed for regulatory approval of an mRNA vaccine for the respiratory syncytial virus, or RSV, a cold-like illness that can be severe in infants and older adults. The company also has an mRNA flu vaccine in late-stage clinical trials. An interim analysis in September showed that the shot outperformed traditional flu shots across all age groups, according to Moderna. Pfizer is also still testing a mRNA flu vaccine, as are Sanofi Pasteur and GlaxoSmithKline in partnership with CureVac. And several of the companies are also working on combination vaccines that protect against COVID-19 and the flu. There are a couple of reasons multiple companies are focusing their mRNA efforts on the flu. First, current flu vaccines rely on viruses grown in chicken eggs or cells, a laborious process that takes months. Using mRNA for flu vaccines would eliminate the need to grow the virus and speed the process substantially. And it will cut out the need for chickens and eggs because y'all going to be eating bugs. That might allow for a better match between the vaccine and circulating flu strains and a quicker response should an influenza pandemic occur. The other reason that The other reason is that researchers can add in mRNA for many different flu strains to create a vaccine that might provide broader protection. Last year, a team of University of Pennsylvania tested an mRNA vaccine containing antigens from all 20 known influenza subtypes that infect humans. In mice and ferrets, the vaccine protected against strains that matched the vaccine and strains that didn't. This year, the National Institutes of Health launched a clinical trial to test another mRNA flu vaccine that doesn't contain multiple antigens but is designed to elicit a response to a portion of the virus that isn't as likely to change from year to year. Flu is just the beginning. The list of diseases for which mRNA vaccines are being developed goes on and on. List to list. Malaria, HIV, Zika virus, Epstein-Barr virus, cytomegalovirus, don't know what that is, herpes, norovirus, Lyme disease, Nipah virus, C. difficile, hepatitis C, leptospirosis, tuberculosis, shingles, acne, chlamydia, and many others. But wait, there's more. mRNA could be a powerful way to treat diseases, not just prevent them. In fact, it was originally envisioned as a therapeutic. mRNA-based therapies for cancer have been in trials for a decade. The idea here is to provide mRNA that codes for proteins on the surface of the tumor. The immune system would then learn to recognize these antigens and it can more effectively detect and attack cancer tissue. Companies are also working on mRNA therapies for rare diseases like cystic fibrosis. People with the disease have mutations in a gene called CFTR, the cystic fibrosis transmembrane conductance regulator. These mutations mean that CFTR protein, which helps water move in and out of cells, doesn't function correctly, leading to sticky mucus that clogs the lungs and causes recurring respiratory infections. Vertex, in collaboration with Moderna, has developed the mRNA that is designed to be inhaled. Once inside the lungs, cells translate the code into functional CFTR. Late last year, FDA gave Vertex the green light to launch a trial to test mRNA for cystic fibrosis. Moderna has also launched clinical trials to test therapies for methylmalonic acidemia, a disease that affects the function of the liver, and propionic acidemia, a rare metabolic disorder. I apologize for butchering these things. Not all these efforts will succeed. In fact, many won't. But the mRNA bonanza is sure to yield some wins. When Carrico and Weissman made their breakthrough discovery in 2005, I told Katie our phones are going to ring off the hook. Weissman said in an interview with Boston University's alumni magazine in 2021, but nothing happened. We didn't get a single call. Today, I think it's safe to assume their phones won't stop ringing. So, with that said, let me share this with you. So it says read more from our archive. So I won't talk about their archive, but it says from around the web. The story of how Nobel winner Caitlin Carrico got demoted and persevered on X. The CDC and prevention says a common antibiotic could protect some people against sexually transmitted infections when taken after sex. And why is life expectancy falling in the US? Um, just a lot of different health stuff that you should read. Uh, okay, I'm done with this story. I have things to add, but I can't add them on the YouTubes. So the link to this article will be in the description. I should hope that you take the time to read it, go over some of the other things that I have shared with you, check out my content on Rumble about this particular technology, and understand that this is meant to validate this technology and its future use. Um, be careful out here, y'all. It's getting wild. All right. This is Marley K. Keep prepping, keep praying, keep seeking the Most High for guidance and wisdom on how to navigate these crazy times because we in danger, y'all. All right. Love y'all. Please like this video, share it, and subscribe to the channel. Links to all the social media platforms that I'm on are in the description, as well as a link to support the channel should you desire to. All right. This is Marley K. Love y'all, and I'm out.